The radiofrequency coil also has some risks to it. And the main reason is that, as you remember, the radiofrequency coil emits energy, which gets absorbed inside the human, inside the body, inside tissue, and then gets re-emitted. However, not all of the energy gets re-emitted. So some amount of that energy does get absorbed. And so it's important to monitor just how much energy is getting absorbed by the body, because there's only so much energy that somebody can safely absorb. And I'll explain what the risks are in a second. So with respect to MRI, we often talk about SAR, or specific absorption rate. And this is a measure per kilogram of just how much energy can somebody withstand safely. So the MRI machine is always monitoring the SAR, and it has happened to me that the MRI machine sometimes just shuts down and stops its activity in terms of stops acquiring images because the SAR is exceeded. And SAR is a function of just how much energy is being emitted by the MRI machine. So SAR is a function of many things. For example, the flip angle or the number of radiofrequency pulses. If you think of it, think back to when we were learning how to take protons that are inside B0 and to push them out of B0. You remember that what we said is that you have to slowly push them, right? And you have to push them at their Larmor frequency. Now, in order to do this, it means that you're giving a lot of pushes, and it's taking time to push protons from inside B0 to a certain angle from B0. So in the sense that the greater the angle at which you want to push protons, the longer you have to push for. So if you use a flip angle of 10 degrees, you might only have to push for a little bit. If you use a flip angle of 90 degrees, you will have to push for longer. And as you push for longer, it means that you're injecting more radio frequency. So, of course, if a sequence requires more radio frequency pulses, again, you're injecting more energy. So the specific absorption rate is really a function of two things: the weight of your participant, because that determines just how much energy they can withstand, and how much energy the particular sequence you're using is emitting. And as I said, this is a function of many things, including the flip angle and just the number of pulses that a certain sequence needs. And you can really think of this as just how much energy are we emitting, and how much energy can somebody safely absorb without any risk. Now, the risk here is that this energy could induce current and therefore burns. For example, if somebody has their hands, when we put participants in the MRI, we typically lie them down on their back, and we always tell them, don't create any circles. So for example, we always tell participants not to hold their hands like this, maybe on their chest. We always tell them not to cross their legs, because these might create loops. And if you create loops, it is possible that that current might be induced in that, and thereby that might create loops and therefore burns. Another risk is tattoos. Most tattoos are typically fine, but shiny tattoos, colorful tattoos, often are made shiny and colorful by using microfragments of metallic type material, which means that there is a risk if somebody has a big tattoo that it could, if the person absorbs a lot of energy, it could heat up and burn the participant. So this is a risk that, as you'll imagine, could happen often. So we always ask our participants if they have tattoos. We ask where the tattoo is. In the case of our devices, which are focused on the head, if somebody has a tattoo on their waist, on their leg, not a big deal. If somebody has a tattoo sort of on their face, then that is risky. if somebody has a tattoo on their shoulders and on their arms, there are different levels of risk. But if somebody has a tattoo, you want to think about whether you truly want to put them inside an MRI machine, particularly if you're doing sort of the kind of fancy, advanced, interesting sequence that somebody in research would do, such as fMRI or such as other type of sequences, for example, to look at the structure of a brain with DTI, diffusion tensor imaging. And so finally, as I was saying, the two variables are how much energy is being emitted and how much energy can a body withstand. And that is a function of the weight of the person. Typically, the greater the weight, the more energy somebody can withstand and dissipate with no problem. You know, the amount of perspiration is another one. So for example, we often ask participants if they're taking any type of drug that alters their perspiration. Because if it does, that might change the amount of RF energy that they are able to absorb given their body size and dissipate with no risk. Finally, the last safety component relates to gradient fields or the gradient coils. See, the problem with the gradient coils is that they turn on and off very quickly. If you remember, think of the slice selection gradient, the Z gradient. Typically, we want to acquire a slice. So at the beginning of the sequence, we turn on the gradient, we quickly insert the radio frequency pulse. As soon as the radio frequency pulse, we turn off the gradient. And so there's this, and then we turn on the Y and the X gradient and turn them off very quickly. So the risk here is a rapid change in magnetic field over time, or dB/dt. So this on-off switching and this on-off alteration in the strength of the magnetic field also can induce a number of unwanted effects. Now, some might literally be stimulation, either of a central nervous system. So some people often report tingling sensation or report phosphenes. If you don't know what those are, it's like little sort of flashes that you see. They are called phosphenes. So you can get stimulation of the central nervous system through these gradient coils. You can also get stimulation of peripheral nervous system. You can get stimulation of muscles, so you can experience little twitches. Similarly to the radio frequency pulse, they can induce current induction and thereby the risk of burns. So tattoos again are a risk also with respect to gradient fields. And importantly, if somebody has an implanted medical device, this rapid change in magnetic field could lead to potential malfunction. So this is, if you work with patients, you need to know if they have any implant, and if they do, you need to track down the exact implant they have, and you have to understand whether it can withstand undergoing MRI or not. So because of all these risks, for example, here at the Staglin Center for Cognitive Neuroscience, which is one of the two major research MRI facilities at UCLA, we have operating procedures meant to minimize all these risks. As I said, overall, MRI is a very safe technique. You just need to, in of itself, you just need to avoid the potential risks that come with operating radio frequency coils, gradient coils, and a large static magnetic field, which essentially is a large magnet. So this is an example of a screening form that we would give any participant before starting the MRI, before putting them inside the MRI machine. And we would never scan someone unless they've completed one of these. And it's a number of questions. Typically, they're mostly meant to establish two things. Is there any potential for you having inside of you something that is at risk of torsion or dislodgement by the magnetic field? So, for example, have you ever had an injury, for example, to the eye involving a metallic object or fragment? has any metallic object ever, have you suffered any injury because of metallic object with the potential for some fragment of metal still being inside of you? So first, we're trying to understand, is there any potential for this participant having an implant that could suffer and could create damage and could be damaged inside the MRI machine? Then the second type of thing that we ask is there any chance that some drug that you're on might alter not only your cerebral blood flow, but also things such as perspiration? There typically are questions about whether you are claustrophobic. If you think of it, you're going to be lying inside a small tube for just about typically an hour to an hour and a half. And finally, we typically have a long swab of questions of potential things that somebody might or might not have. Aneurysm clips, cardiac pacemakers, implanted defibrillators, et cetera, et cetera. Answering yes to any of these is not necessarily an exclusion criterion. It often is, but many of the times it is not, because nowadays many companies make devices that are MR safe. Many patients will benefit from some kind of implant, for example, an insulin pump or a shunt. But of course, companies that produce these technologies do know that patients often still need to undergo MRI. And so they try to create them so that they are safe to go inside the MR environment. However, if somebody responds yes to any of these, it is a cause for follow-up. So you want to make sure that you determine exactly what the issue is and that you are able to establish that the particular device can safely enter the MR environment. So finally, overall, as I said at the beginning of this presentation, there are no known chronic issues in the sense nobody has ever shown that undergoing multiple MRIs over time is associated with any chronic issue. Now, in fairness, MRI has now been around for some 30, 35 years, so I would imagine that if there were long-term issues, some might start manifesting themselves. So overall, it is generally believed that MRI is safe in the sense undergoing one or more MRIs doesn't seem to be associated with any negative event or outcome. There are, however, other important acute issues beyond those that we've discussed, meaning beyond the dangers that might be associated with being nearby a magnetic field or the various coils. Now, for example, claustrophobia is certainly an important issue in the sense patients are typically lying down inside an MRI machine, which boils down to a tube, in fact, a pretty tight tube at times. So claustrophobia could be an issue. If you're using MRI as a research tool, it might happen to you that some participants might just not want to undergo the MRI because being tight inside the tube might just be a little too much for them. Some people do experience dizziness. I myself, in fact, experience dizziness almost every single time I enter an MRI machine. And this is most likely associated with the transition as somebody is placed on the bed of the MRI and then moved inside of the MRI, you're rapidly transversing a changing magnetic field. So that might induce dizziness, perhaps acting on the otholites in the ear or via other mechanisms. Finally, actually, one to last, noise is also an issue. And now I've never played that for you, but the MRI machine makes a lot of noises. In fact, different acquisition types will make very typical noises. And it tends to be pretty loud. And this has to do with the gradients switching rapidly, typically. So the MRI machine can be very loud, and for this reason, we always provide our participants little earplugs that they have to wear when they go inside the MRI machine. Now, finally, and this is perhaps one of the most interesting ones, there might very well be psychological factors tied to undergoing an MRI. A few years ago, somebody did a survey in which they had an MRI that was 4 Tesla. However, it had been decommissioned and quenched. In other words, even though it said 4 Tesla, and even though everybody pretended that the MRI was 4 Tesla, there was no magnetic field produced from the MRI. And the experimenters would put the participants inside the MRI machine, and then later, once they came out, they would debrief them and ask them, did you feel any unusual sensation? And 45% of participants did report unusual sensations, ranging from dizziness to phosphenes to sensory sensations, when in fact there was no MRI, there was no magnetic field. So just the idea of entering this device might in of itself have some psychological components. So as scientists who are interested in how the mind works, and as scientists who study the brain in order to understand the mind, we do have to keep in mind the possibility of these type of psychological processes happening when our participants go inside the MRI machine.